Hi everyone, this is the first of two brief videos on eating disorders. So eating disorders are a pretty common psychological disorder, and they seem to be becoming more and more common. So if you look at the data, around 13% of girls and 7% of boys tend to display disordered eating. That doesn't necessarily mean they meet the full criteria for an eating disorder, but they tend to display some patterns of disordered or dysfunctional and kind of unhealthy, not unhealthy in terms of diet, but problematic ways of eating. And the rates of these disorders seems to be going up. The rates tend to be highest in girls and women, but the rates also seem to be growing in men, and we'll talk more about why that might be in the next video. There are three types of eating disorders. The first one is anorexia nervosa, or what most people refer to as anorexia. Then there's bulimia nervosa, and the third one is binge eating disorder, and I'm going to go briefly over each one of these. So anorexia is an eating disorder that's characterized by the refusal to maintain a body weight kind of above the minimal normal weight for a person's age and height. And the normal weight is something that a physician can calculate based on your age, your height, your body frame, activity level, those sorts of things. Okay. So people with anorexia oftentimes are well below what would be considered to be their normal or ideal body weight. And people with anorexia tend to have an intense fear of becoming obese or becoming overweight. And they oftentimes have a really distorted perception of their body. They oftentimes have a very perfectionistic attitude toward their body. And what they see, for example, when they look in the mirror, is not what most people looking, or almost everyone looking at them, would see. While they may be quite thin and may even look malnourished, they may see someone who is overweight. And as a result, they kind of get stuck in this cycle of obsessing around their body weight and therefore going to great lengths to lose the weight. Unfortunately, they get stuck in the cycle too of there's never a point where they feel good enough. So they may think I need to lose 5 pounds, and then they look in the mirror when they've lost those 5 pounds and still feel unhappy with what they see. So they may feel like I need to lose another 5 pounds, and they really get kind of stuck in this vicious cycle. There are two types of, or subtypes of anorexia. There's the restricting and binge eating purging type. I don't care too much that you know the difference between those, other than I want you to understand folks with eating disorders may go to great lengths to lose weight, oftentimes through dieting, exercising, or restricting the amount of food they eat. So, sometimes you'll hear stories. I have colleagues who work with eating disorders where someone they know may be consuming, or someone they're working with may be consuming only a few hundred calories a day. And you could imagine someone who's only eating that few calories is going to lose weight, and lose weight pretty quickly. There are some associated characteristics with anorexia. There's some things that we tend to see kind of comorbidly for folks who struggle with anorexia. Fairly commonly, people with anorexia also struggle with comorbid mental health problems such as depression, anxiety, obsessive-compulsive behaviors, and obsessive-compulsive types of disorders. They oftentimes are quite introverted, oftentimes very perfectionistic and rigid, and may have problems with impulse control, those sorts of things. And they tend to use the eating disorder as a way of kind of controlling the depression and coping with the obsession, the obsessional thoughts they have related to their body image and those sorts of things. Unfortunately, people with anorexia oftentimes will develop physical complications, and these can include cardiac problems. I've had colleagues tell me stories of young ladies they've worked with who were in their teens to early 20s and have gone into cardiac arrest and have heart attacks. They may have low blood pressure, they may have weakened heart muscles, bone loss. I've had colleagues of mine talk about young ladies, again, mostly young ladies that they've worked with, who have essentially had something very close to the equivalent of like osteoporosis at a very young age. Women with anorexia may struggle with amenorrhea, which is the loss of their menstrual cycle, which may pose problems for fertility problems down the road. There's a whole host of health problems that can go along with this, including just malnutrition and essentially starving to death. Okay. As a result, I oftentimes encourage students to think of anorexia as well as the other eating disorders as more of a not just a psychological condition, but also a physical health and medical condition because of the physical complications that oftentimes come along with it. All right, so the second eating disorder I want you to be familiar with is bulimia nervosa. And bulimia is a little, actually it's quite a bit different from anorexia. So folks with bulimia tend not to engage in restrictive eating and oftentimes aren't malnourished necessarily, and they aren't well below body weight. They do tend to have a concern with their body image and weight very similar to what people with anorexia struggle with. However, they oftentimes feel like they can't control their eating, and so they may end up experiencing frequent episodes of binge eating where someone consumes large quantities of food over a short period of time, and they feel like they can't control that. So it may be someone who, for example, sits down pulls out a carton of ice cream from the refrigerator and says, I'll just have a couple scoops, and 30 minutes later has eaten the entire carton. Or someone who orders a pizza and says, I'll just have 2 or 3 slices, and then the whole pizza ends up being gone, right? So, and it's because they feel like they can't control their eating. There are 2 subtypes of bulimia. Again, I don't care too much that you know the difference between these, but understand that folks who struggle with bulimia, in order to essentially cope with their binging, which oftentimes leads them to experience tremendous guilt and remorse, they may engage in what we call compensatory behaviors to make up for the binging and to reduce the guilt and anxiety they feel for having binged. So for folks with the purging type of bulimia, they may do things like regularly vomiting to help eliminate some of the food from their body, and the belief that they'll eliminate calories, which they're not. It actually doesn't do a particularly good job of eliminating calories. They may use laxatives, diuretics, enemas, those sort of things, and if you know how those work, obviously you're not getting rid of the calories at that point, but you may be alleviating physical discomfort and that sort of stuff, and getting rid of water weight and that sort of stuff. The non-purging type may engage in, well, they may not necessarily vomit or use laxatives, but they may use frequent fasting or excessive exercise in order to compensate for binging. So it may be someone who, let's say they've binged on a carton of ice cream and downed, I don't know, something like 3,000 calories. They may then decide to go for like a 10-mile run to burn off all of those calories, especially if it's someone, and it might not be someone who actually tends to run that much, but they might decide, I'm going to exercise a lot so that I can burn off those calories. So I mentioned that oftentimes people with bulimia oftentimes feel ashamed and guilty due to their binging. So they will oftentimes hide it from other people, and that's because they're aware their eating habits are not normal. This is different from anorexia because many folks who struggle with anorexia do not see what they're doing as abnormal. They don't see their perceptions as being distorted. And so therefore they oftentimes will lack that level of self-awareness. People with bulimia nervosa tend to be quite aware of that. In addition, they oftentimes tend to be in the normal weight range, or they tend to be a bit above normal weight. They might be even a little bit overweight. And that's because of the frequent binging. Even though they may engage in those sort of compensatory behaviors like purging or excessive exercise, if they're binging and binging frequently, they're going to probably be putting or consuming so many calories that it's hard for them to lose the weight, and so it's going to keep them at kind of a normal weight or even above normal weight. And similar to anorexia, folks who struggle with bulimia also tend to struggle with depression. They may have impulsivity problems, which makes sense because they have problems controlling their hunger impulses. They may also show some traits of what's called borderline personality disorder too. They too can have some physical complications. They can be quite severe, not generally as acutely severe as folks with anorexia, but you can see due to like frequent purging, you can see the stomach acid eroding someone's teeth enamel. If they're frequently purging or using laxatives, they may lead to dehydration. They may have other gastrointestinal problems due to purging and using laxatives, or just frequently consuming large amounts of food. They can also have heart problems, a whole host of issues. All right, the last eating disorder I want you to be familiar with is what's known as binge eating disorder. And people with binge eating disorder probably share more in common with people with bulimia than they do people with anorexia. In fact, this tends to be the polar opposite of anorexia. So people with binge eating disorder, they tend to consume large quantities of food. They tend to binge on food, and they may binge frequently. And they may experience distress over doing it. They oftentimes feel like they can't control their eating, similar to what we see in bulimia. The difference is they tend not to obsess so much about their body and what they look like, and they don't use the compensatory behaviors like vomiting or excessive exercise that people with bulimia do. Okay, so it's really kind of like bulimia, but without the purging or other types of behavior, right? It's just the binging sort of behaviors. Because someone with this particular disorder just binges and they don't use any of the compensatory behaviors, they tend to be overweight or obese, okay? Because they're consuming large quantities of food at time. They're not necessarily doing anything that would eliminate those calories or reduce the calories they've consumed, and so therefore they tend to put on a lot of weight. They also tend to have lower moods. They may struggle with depression. They may struggle with impulsivity, particularly regarding to eating. They also tend to crave sweets. So when they binge, it may be on like candy, ice cream, those sorts of things. But they may also binge on other kind of more unhealthy foods. Like people with anorexia and like people with bulimia, they too have physical complications, although the complications someone with binge eating disorder has may not, at least not initially, be as acute and life-threatening, but over time they can become life-threatening. So someone with this particular disorder may have high blood pressure, high cholesterol based on diet and the type of foods they're consuming. They may have heart problems. It's not unheard of for people with binge eating disorder to have heart attacks and those sorts of things, as well as they may develop type 2 diabetes. Okay, so that's all I want to say about the eating disorders. In the next video, I'll talk a little bit about what we think causes people to develop these disorders and the treatment for them.